Hello, I'm Dr. Kartik Natarajan, consultant gastroenterologist, hepatologist, and interventional endoscopist. I would like to talk to you today about colonoscopy. So, while we have heard of the term screening test for any cancer, let's give an example. The screening test for breast cancer is a mammogram. The screening test for cervical cancer is a pap smear. How many of us actually know that the screening test for colon cancer or colorectal cancer is a colonoscopy? Yes, that's right. Colonoscopy is a screening test. During this test, a flexible tube with a camera at its tip is inserted right from below to study the entire length of the large intestine or the colon. During this test, your gastroenterologist will screen for small lesions called polyps. These polyps, if left untreated, can progress over a period of time to form a cancer. It is to note that all colon cancers arise from these lesions known as polyps, but not all polyps are malignant. That is, not all polyps will turn into cancer. So, right during the time of a screening colonoscopy, your gastroenterologist will screen for these small lesions which may range in size from a few millimeters to as large as 2 to 3 centimeters. And these lesions, called polyps, can be removed at the time of a screening colonoscopy itself. This test is absolutely painless and can be done over a period of 10 to 15 minutes. Yes, it is a daycare procedure. Preparation has to be taken preceding this procedure, following which the patient can walk back home and resume with normal activities. Who all actually need a colonoscopy? So, since it is a screening test, all those individuals who are above the age of 45 years have been recommended to get this test done. The American guidelines, namely the American Gastroenterology Association, the American College of Gastroenterology, as well as multiple societies across the world, have revised the screening age from 50 years to 45 years because of the increasing incidence of colorectal cancer across the globe. So, all individuals after the age of 45 years must get this screening test done at least once and get themselves cleared from their gastroenterologist so as to resume with a normal life. Apart from these, if anybody has chronic diarrhea, that is, loose stools lasting for a period of more than 6 weeks, or a change in the bowel pattern, that is, when the normal stools or a normal fecal pattern changes to constipation or to loose motions, that is for a period again lasting for more than 6 weeks. If you have noticed any blood in your stools, please contact your gastroenterologist and get some information on this screening test and whether it is required or not. All individuals with anemia, which is because of iron deficiency, must get this test done. So yes, the list may sound really elaborate, but it's a test that is needed if you fit any of these criteria. So, if you have any of the symptoms that I have mentioned above, please contact your gastroenterologist at the earliest and get more informed on this tool called colonoscopy. It is completely painless and absolutely necessary to prevent colon cancer.